Dr. Yoni Whitten here, and this week we're digging into the science to find the fastest and most effective way to recover from surgery. Let's get into this. Just last week, I received a question from a member of this community whose mother is scheduled to undergo surgery in a few short weeks. Now, this member's understandably concerned because surgery is a big deal, and she wanted to know if there was anything that she could do to help speed up her mother's recovery and help her get back onto her feet as quickly as possible. Well, in this video, I'm going to show you my top 3 strategies for doing exactly that. Number 1 on our list for accelerating your healing after surgery is light therapy. Now, this is a heavy hitter, and there's actually been quite a bit of research looking specifically into this topic. What I want to do is go over just a little bit of that with you right now. Like this study from 2006 that followed just a small handful of people as they underwent elective surgery, plastic surgery to correct droopy eyelids, and they also were having laser resurfacing of the skin on their face. Now, what was interesting about this study is that 1/2 of these people's faces was treated with light therapy and the other half was not treated, so it served as a control. So you're just comparing that person to themselves, which makes for a really interesting study. Now, the treatment that they received was 20 minutes of light therapy at 633 nanometers. So it puts it smack dab in the middle of the red light spectrum. These people were evaluated for pain, redness, swelling, and bruising following the surgery. And what these researchers found was all of those categories were 2 to 3 times better on the side of the face that was treated with actual light therapy. So that's how much it sped up healing and decreased pain levels. In a follow-up to that study, a group of researchers in 2016 took a sample size that was nearly 3 times as large, and they looked at what would happen if you gave 3 light therapy sessions, again, following elective plastic surgery. Half the face was treated with light therapy, the other half was treated with fake light therapy. So the person who had undergone the surgery and was receiving these treatments didn't know which side was the real light and which one was the fake light. These people were evaluated for severity, extent, and the color of their bruising. Here's one of the subjects from that study, 62-year-old woman. 10 days after her surgery, she had received light therapy to the right side of her face. You can see significantly less bruising, completely different color of the bruising, reflecting much less severity and less swelling along that side of the face, particularly evident around the cheek and mouth area. Here's another patient from that study, 65-year-old woman. She'd undergone a brow lift and had both upper and lower eyelid surgery. Her light therapy was done to the left side of her face. You can see the bruising underneath the eye is almost completely gone compared to the opposite side, and the swelling along the side of the face and underneath the jaw significantly less after just 3 sessions. This study was really interesting because it gave us a look at what's going on not only at the surface, but underneath when light therapy is being applied. It was done in horses. The researchers were looking at how fast these surgical wounds healed and the healing characteristics. Horses received 5 minutes of treatment per day in that 635 nanometer, that red light range. They received a total of 40 treatments. At the end of their treatments, the researchers actually took samples from the wounds and they looked at them under a microscope. Now, the one on the left here is the side that was not treated with light therapy. And you can see how it's very irregular looking. There's a big divot, or what we call an ulceration. You can also see how the cells are spaced out right in this area here. And that's indicative of swelling and basically an incomplete healing at this time. Now, the one on the other side of the screen is the side that was treated with light therapy. And you can see how regular looking it is with those layers. This represents a much more complete healing process, and both were taken at the same day after those 40 treatments of light therapy. So that's histological proof of a more accelerated healing process in the side receiving the light therapy. And then finally, this study from 2015 looked at using 830 nanometers light emitting diode. That is in the infrared spectrum. And what they found in using that spectrum of light after surgery was getting it on as quickly as possible following both invasive and non-invasive surgical procedures successfully hastens the resolution of post-surgical sequelae. It leads to better patient satisfaction, it increases the speed of wound healing, and minimizes patient downtime. And that's why light therapy is number one on this list. There are a ton of light therapy devices out there on the market nowadays, and it can get kind of confusing when trying to select which one is best for your needs. So here are the top 3 things to keep in mind when purchasing a light therapy device. First, the spectrum of light. The spectrums that have been shown to be most effective for healing, growth, and repair and eliminating pain, swelling, and inflammation are the red light spectrum, which goes from 620 to 680 nanometers, and the infrared spectrum, which goes from 800 to 880 nanometers. So make sure that you're selecting a device that operates within those ranges. Some devices like this Red Rush 360 have half of the LEDs in the red light spectrum and the other half in the near infrared spectrum. So you're getting the best of both worlds. Second, you want to consider power output. And for this, just remember that bigger is better. That's also one of the reasons why I went out and spent my own money to purchase this Red Rush 360. It's a very large device, which means I can use low treatment times, just 5 to 10 minutes a day, and that gets me all the light therapy I need for an entire day, which means I'm more likely to actually do the light therapy. And then finally, you want to consider cost. And again, Red Therapy Company, which produces this Red Rush 360, offers the best bang for the buck. You're talking about the lowest prices for the highest power output. On top of that, I've arranged a special discount just for the members of this community. When you enter code PAINFIX, one word at checkout, you're going to get a special discount just for the PainFix Protocol community. If you want to find out more about the science of light therapy and how to set yourself up to be maximally effective, you can check out a video that I did on that topic right here. The second strategy for speeding up your healing after surgery is with the addition of specific nutrients. Now, the first nutrient that I want to mention here is Serrapeptase, which is a proteolytic enzyme that has the unique ability to thin out body fluids and help them to drain more easily from areas where swelling or inflammation is present. It also has the ability to break down fibrin and prevent scar tissue from forming. Both of those are a big deal for people that have undergone surgery. Now, studies done in surgical settings have shown massive reductions in pain and swelling in as little as 2 to 3 days following surgery. Like this study that was done in a German hospital on 66 people that were undergoing surgical repair of a ruptured ligament in their ankle. They divided the people up into 3 groups, 22 people per group. Group number 1 received rest, ice, and elevation. Group 2 received rest and elevation. Group 3 received Serrapeptase only. They were evaluated for pain and swelling 2 to 3 days after surgery. And what they found was that in the rest, ice, and elevation and the rest and elevation groups, there was no improvement whatsoever in those first few days following surgery in the amount of swelling and inflammation and pain levels that they had using those techniques. While in the Serrapeptase group, there was a 50% reduction in swelling, and pain levels tracked very closely with the reduction in swelling. So huge reductions there in those critical first few days, just with the addition of Serrapeptase. And this study from 2018 was a meta-analysis where they looked at all of the data on a subject. In total, they looked at 5 different studies using Serrapeptase following the surgical removal of wisdom teeth. They found that it was way better for swelling and mobility restriction than non-steroidal anti-inflammatory drugs. Of course, it has a way better safety profile. They weren't able to find a single study showing adverse reactions to taking Serrapeptase. Another nutrient that I want to mention, which is also a proteolytic enzyme, this one is called Bromelain, has an impressive body of research specifically following surgical situations, like this study from 2016 that looked at 40 people who were having surgical removal of impacted wisdom teeth, where the surgeon actually has to chip away bone to get to that tooth and pull it out. So pretty darn traumatic procedure. What they found was 70% of people in the study responded very well to Bromelain. It reduced swelling, bruising, pain, and accelerated healing time following these traumatic procedures. And overall, what they found in this study was that in just 7 days, they were able to reduce pain by 82% on average through the addition of Bromelain. One more study on Bromelain, this one on grafting gums, so a gum transplant. Using Bromelain with that procedure, they found that people had 47% less pain, they healed their wounds faster, and they took significantly less, we're talking about 40% less pain medication following the procedure, just by adding bromelain, which again has that fantastic safety profile, just like serrapeptase. Bromelain and serrapeptase are just two of the powerful ingredients in Movement Essentials. Between these two supplements, you're talking 19 essential nutrients put in combination to reduce pain and inflammation, wipe out swelling, increase muscular strength, and improve your functionality. You can use the link in the upper right or the one down in the description to get your Movement Essentials today. The third and final strategy for speeding up healing after surgery is rhythmic movement. And this strategy is so important. There's a bunch of research showing that getting up and moving after surgery actually stimulates the body's healing response, and it seems to cut down dramatically on surgical complications. So take this study, for example, where researchers created a program called Walking to Recovery that they initiated with patients that had undergone abdominal surgery. And the surgeries included a bunch of different types of surgery, everything from bowel resection to gallbladder removal to hernia repair. So pretty serious stuff. They got these people up shortly after their surgeries, and they had them walking around the floors of the hospital. Now, they had volunteers with them to make sure that they stayed safe, which of course is critically important. But when they looked at these people and analyzed the results of this walking program, what they found is that these people had fewer surgical complications than the people who stayed in bed. They had less anxiety, less depression. They got better sleep at night, which of course speeds up recovery. And their recovery scores were over 20% better than the group who wasn't walking. Oh, and by the way, their mobility scores were 62% better. So if you want to be functional after a surgery, you got to get up and move. The results of this study were maintained at the 1-month follow-up. Then another study, they looked at over 360 people who were doing a cycling program 2 weeks after either a total hip or a total knee replacement. They used an outcome measure of the Western Ontario and McMaster University Osteoarthritis Index, which checks for pain, stiffness, and physical functionality. And what they found in this study was that moving the body in that rhythmic fashion following these very intense surgeries of a total hip or a total knee replacement, they found that their physical functionality was 25% better after 3 months than the group that wasn't cycling, and it was 40% better 2 years in. So you got to move your body. It leads to better outcomes, less pain, and a faster recovery. No two surgeries are exactly alike. Because of that, you should always check with your surgeon to see which type of rhythmic movement is going to be best for your unique situation. The topic for this video was a suggestion from viewers just like you. So if there's a specific pain, posture, or rehab related topic that you want to know about, leave a comment down below and I'll make a video about it. I'm also going to put down in the description links for Movement Essentials, a recommendation for my favorite light therapy device, as well as links for all of the studies that I covered in this video. Before you head out of here, make sure to give this video a thumbs up and subscribe to the channel so that you're updated every time a new video drops. That's all for now. See you next week.